In Module 7, we're going to go ahead and discuss the origins of paraphilia and then get into some of the types of treatment that we can see for these particular disorders. And so one of the things and characteristics, as you may have gathered by now, is that paraphilia is almost always male behavior. And they base that on the fact that almost 95% of people who seek treatment for these various paraphilic disorders are men. As far as factors that influence the development of paraphilia, there is a high rate of overlap in regards to it, so that the causes or biological underpinnings of those kind of interests and behaviors that lead to the paraphilia might most appropriately be viewed in kind of terms of the common factors that they all share in regards to the biological influences. What you're going to see more is in the differentiation between paraphilias is in regards to the social factors. So there are some types of the paraphilias that seem to be distortions of the normal mating process when viewed in kind of a broad evolutionary kind of context. So things like voyeurism, exhibitionism, Freuderism, they all represent kind of aberrant versions of the social process of courtship. So that's why some of the types of paraphilic disorders have been described as courtship disorders. And so there you have some good old-fashioned courting going on there. And then think about how that can maybe get twisted. So you have this kind of twisted aspect of typical courtship or normal mating behavior. And the reason for that is some of these background factors. So the first one there is the early crossing of normative sexual boundaries through direct experience, in this case, things like sexual abuse by an adult, or indirect experience where you hear about a father's atypical sexual behavior, and that starts to get internalized into your mental map. There could be a lack of consistent parental involvement in which normative sexual behavior and values are modeled. So once again, it's the early influence in childhood and adolescence that we talked about previously is going to form some of the basis here. So back when we talked in, I believe it was module 5, maybe there. A lack of self-esteem and confidence and ability in social interactions. So you have these people that really don't or can't fit in very easily with typical people in their conversations. They may not feel very confident about themselves, and they may not even really understand human sexuality, kind of healthy human sexuality and what that looks like. And so you can see a paraphilia developing as a result because they still have these urges and desires that is a normal part of being human. Psychological factors, love maps, these frankly sound a lot like mental maps. They're a little bit different parts of your chapter, but they basically are the same thing, other than love maps are more mental pictures on your ideal sexual relationship. I guess people have to access their love maps anytime they go onto, say, a dating profile, and they're forced to kind of think about what they see their ideals are. And just like the mental maps, they are quite persistent, or mental scripts, I believe we called them. They're kind of programs that are written very early in life, adolescence probably at the latest, and they're quite persistent about the ideas. So if you have a lot of people, a lot of women running around out there who want to be princesses and swept off their feet with Prince Charming, I guess you can go ahead and blame Disney for their love map and kind of some of the ways that they view how things might evolve. Other ways that children learn love maps, sexual play and exploration that they do with each other as they kind of explore each other's bodies, especially when your body doesn't look like my body, and why might that be? Imitation of parents and other adults and kind of mirroring some of their particular types of behaviors. And then also messages that they get through popular media, whether it's Disney or it's more hardcore kind of content. And all of that's going to go into their mental map. And so that's going to be the basis for a lot of these paraphilias. You have a little bit of biological influence, but a lot of social and psychological influences that result in the people having their proclivities that they do. As far as treatment, most people are not going to enter treatment voluntarily. In that way, they have that in common with personality disorders. There have been a couple of different approaches that your book kind of highlights. First was aversion therapy. So basically, remember we talked about how there could be classical conditioning going on with, say, masturbation to particular images, meaning that those people become more dependent upon those images to become aroused. Aversion therapy is trying to break that link and create a new association with the inappropriate stimulus, and so that the association will be a negative one. And then after a while will no longer elicit that sexual arousal. Unfortunately, that doesn't seem to have really worked. And so that a particular approach has fallen into disfavor. And surprise, surprise, here we have cognitive behavioral therapy engaging in things like cognitive restructuring, social skills training, and things like stress management procedures. All of these in an effort to try to help the individual to decrease their likelihood of returning to deviant forms of sexual behavior. It is a more successful, CBT is more successful approach than aversion therapy, but both approaches are fairly discouraging in far as how effective they are, because they really are looking for trying to not have, so for instance, somebody who's a pedophile, there's a reason there's a sexual register that we have on individuals with pedophilia, because they are incredibly resistant to our efforts at therapy and redressing these types of fixation, and obviously can be a danger to the community in many cases because of those urges and compulsions to engage in those acts. Something that's met with a little more success is use of hormones and medication. In extreme cases in the past, they've even had chemical castration for people that engage in repeated pedophilia. However, that has fallen into disfavor too, but they still do use drugs to try to reduce testosterone on the idea. If you remember when we talked about testosterone in this chapter earlier, it's supposed to reduce the appetite, sexual appetite of individuals. And so if you have some drug that reduces the natural levels of testosterone in these individuals, the hope is they won't engage in those behaviors because they don't find them as appealing. The results are somewhat mixed in regards to that. So as you can tell, we don't really have a whole lot of options as in regards to treatment for paraphilia, and the ones that we do aren't overly successful. And so we kind of got to go back to square one. Now, in our last module, Module 8 for this Chapter 12, we're going to look at gender dysphoria, which is a whole other thing beyond paraphilia. So tune in.